All right, so let's talk a little bit about the pectoral girdle and the upper limb. So we talked briefly, you've got the torso models out here, so you can kind of see those, or the long man and the short man. So here on the chest, you've got the pectoralis major. So for some of the models you have there on the other side, you can see the deeper muscle, pectoralis minor. Okay. Shoulder, you can see the deltoid. That's on the anterior surface. You can also, in some models, you might be able to see coracle brachialis, but you may not. It's kind of a deeper muscle. All right. On the posterior surface, you can still see the deltoid in the shoulder. Kind of along the midline, you got the trapezius and the latissimus dorsi in the lower back, okay? Or on the sides of the body. Now, deep to those muscles, you have the levator scapulae, which elevates the scapula, the rhomboid minor and rhomboid major, okay? Connecting the scapula to the spine. Now we also have muscles in the scapula, but we're not really going over that in these pictures. So just want to make sure you know where the deltoid is, where the pectoralis major is, okay? Pectoralis minor, all right, trapezius, latissimus dorsi, okay? All right, everybody see those five? We good there? Any questions on those? Okay. Oops. Another view. Again, see the pectoralis major, deltoid. So here's your biceps brachii. Okay, you got the short head and the long head. But basically, you're going to just need to know this is the biceps brachii. You can see a bit of the brachioradialis here. Or sorry, brachioradialis here and the brachialis here. Okay, so you'll need to know those two. Again, on the posterior surface, latissimus dorsi. All right, so a couple of muscles here. On the above the spine of the scapula, you've got the supraspinatus. Inferior to the spine, you got the infraspinatus. Okay, you also have teres minor and major. Okay, and on the posterior surface of the arm, you can see triceps brachii. Okay. All right, so I'm gonna give you all a couple of minutes to find those on your models. Okay. You can do this at home, practicing on your models if you have them, or using the study guide. All right, so near the axillary area, you can see the serratus anterior on the anterior surface of the body. Okay. All right, so we'll also tell you action, deltoid, it's gonna abduct the arms. If you think about it, just think about what the muscle would do if it contracted. So if your deltoid contracts, you're gonna move your arms out, so you're abducting. Pectoralis major, you can flex your arm, okay? Medially rotate your arm, and then adduct your arm. So if we've done, cable curls, things like that, like you're using your pectoralis major to adduct. All right, serratus anterior, it protracts and inferiorly rotates your scapula, okay? Because it does connect to your scapula. All right. Here you get a view of the pectoralis minor, depresses your scapula. Okay, if you look at where it's attaching, if it contracts, it's going to pull the scapula down. Okay, you get a small view of subscapularis, which helps with adducting and medially rotating the arm. And your subclavius, okay, touches just below the clavicle, so it's subclavius, helps with abducting the arm. Okay, so if it contracts, it's going to pull the arm up. Okay, again, trapezius, It's going to elevate, retract, or depress the scapula. Look at where it's connection to the scapula. So you can elevate your scapula, like if you're doing shoulder shrugs, okay? Depending on also where it attaches, it could also depress the scapula. Okay, your infraspinatus. Okay, this one is one that you usually can see. So this is one of those that you can't see on your long and short man. All right. It has the lateral rotation of the arm. So rotating the arm out. Okay, here's a view of the supraspinatus. Okay, involved. If it pulls, helps you abduct your arm. Okay, again, teres minor and major. Laterally rotates your arm. Okay, if it contracts, kind of pulls your arms out. Teres major actually helps with extension of your arm. So bringing your arms down this way and adducting and medially rotating your arms. Your Latissimus dorsi, again, is extension. So bringing your arms down this way, adducting, and medially rotating your arms. So if you've done rows or rowing exercises, you use your Latissimus dorsi. Yeah.
What's the difference between the red and the white models?
So the whites look like this white's mostly bone. Okay, and then these are like tendon, connective tissue, tendon.
Oh, the white is tendon?
Yes. Okay. So go a little deeper, you can see the levator scapulae. Elevates the scapula. Rhomboideus minor, it elevates the scapula. Rhomboideus major elevates the scapula. Okay, but these are deeper, so you wouldn't see these unless you had a deeper section. Okay, and here's where the serratus anterior attaches to the scapula. Okay, so it kind of goes around the side of your body. Okay, let's talk about the arm. So as you learn about what the arm muscles do, this is kind of a good rule of thumb. So this is sort of the upper arm, the lower arm, and the anterior view. If the muscles are on the anterior surface of the arm, they help with flexion. And in the forearm, okay, they can also help with flexion. Flexion of the forearm, or flexion of the hand. Now, on the posterior view, muscles on the posterior surface of the upper arm are going to be involved in extension. Okay. And muscles on the posterior surface of the lower arm or forearm are going to be involved in extension. Okay, like the muscles that help you extend your fingers. Like extend your wrist. So the muscles here help you flex your wrist or flex your fingers. Okay. All right, so here's your biceps brachii. Helps you flex your arm and your forearm. Just slightly deep in medial to that, coracoid brachialis. Helps you flex and adduct your arm. Posterior and deep to the biceps brachii is the brachialis. Helps you flex your forearm. And your brachioradialis on the radial side of your arm, right? Your thumb is on the radial side. Helps you flex your forearm as well. So if you think about it, again, if you're in anatomical position, you move your arm in or move your wrist towards your body, you're flexing your forearm, right? You should be able to feel that. All right. So before we touch the next 4 muscles, I'll give you a minute. You should all have an arm model. Most of you have an arm model at your table. So you should be able to find these on both the whole man model as well as your arm model. So we'll work on that now. Okay, some more muscles on the anterior surface. Okay, so if you're starting on the ulnar side, on the pinky side, you have flexor, carpi ulnaris, which helps you flex and adduct your wrists. So you're essentially moving the wrist back toward the midline of your body. Okay, moving laterally, then you have palmaris longus. That also helps you flex your wrist. And lateral to that, flexor carpi radialis, because it's more on the radius side, also helps you flex and abduct your wrist. So, because it's on the radial side, it's going to be more for abducting. Flexor carpi ulnaris is more for adducting the wrist. Okay. And then close to the wrist, you have pronator quadratus. As the name suggests, helps you pronate your forearm. Okay. And so remember, pronation, supination. So that pronator quadratus helps you pronate your forearm. Okay, so let's give you a minute to look at those. All right, so the next set of muscles, we got supinator. Okay, we just looked, we had pronator quadratus. We also have the supinator. Helps you, so when you're pronated, helps you supinate your forearm. Okay. All right, so in this one, you can also see the Flexor Digitorum Profundus. It's a little deep muscle. Okay, helps you flex your wrist and your fingers. Okay. But essentially, if you move your brachioradialis and flexor carpi ulnaris out of the way, just underneath it, you can see the Flexor Digitorum Profundus. Okay. So on the superficial side, on the posterior view, you can see the triceps brachii. Remember, it's on the posterior surface, so it extends your forearm. Okay, near the elbow, you have the brachioradialis. You can still see it from this angle. Okay. Now you can also see, because we're on the posterior surface, the extensor carpi radialis longus. So based on the name, we know it's on the radial side, the thumb side, pollex, and it's an extensor. It extends and abducts the wrist. So the wrist is here, helps you move your wrist back toward anatomical position. Okay, also helps you extend your wrist. Now close to the wrist, you have the abductor pollicis longus. As the name suggests, helps you abduct your wrist and extend your thumb. So if you're extending your thumb, you might be able to feel in your, close to your wrist, some activity there through your abductor pollicis longus. So I'll give you a minute to look for these. All right. So we also have the extensor digitorum. Okay, more on the posterior surface of your forearm here. The large muscle there, that's the extensor digitorum. As the name suggests, it extends your digits, also your fingers, also your wrists. Extend your wrist out. So if it contracts, it'll pull your hand back. So you're extending it. Okay. Lateral to that, or actually medial to that, you've got the extensor carpi ulnaris. Okay, helps extend and adduct your wrist. Okay, name suggests that it's going to attach to the ulna, right? And you can see a little view of the flexor carpi ulnaris as well. Okay, so give you a minute to look over those, and that's the arm. Okay, we'll go over the leg on Tuesday, but that's the arm. Okay. And again, it's all about practice. And what's good for learning all this? Well, you've got in mastering, you have practice anatomy lab. You can make flashcards online. You can also quiz yourself, looking at the different structures. Okay. Also, I added some purpose games. I'll get some more added on the arms and the legs as well. Those are things you can do to practice and quiz yourself. Okay. Also, we'll get some muscles in the concept lab for you to practice on. So should be able to get a practice practical up soon, if not already. So you've got opportunities to practice. There's digital practice practical. I think I've got some different worksheets that are up as well. So lots of different ways to study. Study groups are always good. You know, should definitely consider that.
Just make sure I have it correctly.
Sure.
Origin
It is the basically stable point of connection to a bone. Insertion is more of the movable point.
So what will be on my quiz?
So your quiz is going to basically over muscles of the head and neck. Muscles of the head and neck. Okay. You could see something also related to levels of organization. So I would say like the sarcomere, the endomysium, paramysium, epimysium, all that stuff. Muscles of the head and neck. Okay. So that's what I would study for the quiz.
That's next Thursday.
Yes.